Good morning, everyone. Indeed, it's a pleasure to have you here at our very, very critical and important program. Of course, I would like to start off by welcoming you, each of you, attending today. We are going to begin with some very important remarks, and so I would like to firstly start off by following protocol. Dr. Narayan Singh, Chief Medical Officer at the Ministry of Health, delivering remarks on behalf of the Honorable Dr. Frank Anthony, Minister of Health of the Cooperative Republic of Guyana, Miss Heather Stewart, Child Protection Specialist at UNICEF for the Eastern Caribbean area, who will be bringing remarks on behalf of Mr. Abdul Kadir Musi, the representative for UNICEF for the Eastern Caribbean area, presenters, and members of the Caribbean Suicide Decriminalization Coalition, officials, and you, our very important and critical guests. Welcome to a webinar of action. Welcome to a webinar of change. I am your moderator, Bertrand Moses, Child Protection Officer at the UNICEF for the Eastern Caribbean Area Office. This Suicide Awareness Month is no ordinary month. Thank you for showing your commitment to suicide decriminalization and the suicide prevention by showing up today in your numbers, and we must thank you for that. This is our time for regional action. I invite you at this moment to reflect. Reflect on someone that you may have lost due to suicide. Reflect on someone that you may have read about that may have died by suicide. Reflect on a friend who may have been affected by a loss due to suicide. At this time, I'd like to engage you in this chat, and I'd like you to type an initial or initials of that person. Honor their legacy. Honor this movement by typing in the chat one initial, just something to honor them, to remember them as we have this very critical discussion. I see that the chat is now lighting up, and that's what we want to do. Light up the chat as you would light a candle in memory of this person. For today, we honor their lives and the times that they felt as though there was no hope. Over the past year, the Caribbean countries have reported troubling increases in child, youth, and male deaths by suicide. The World Health Organization reports that suicide is the second leading cause of death among young people aged 15 to 25. So this is an urgent issue. I therefore say to you today you will have the opportunity to learn practical ways to help someone in need. We will also explain the procedures for decriminalizing suicide so that you can advocate. And we'll also describe how we can work together to decriminalize suicide as a cooperative. We will also talk about effects and efforts of suicide, and we will come to a conclusion around how you can help a friend and be an advocate for change. During this webinar, we will have a question and answer segment at the end. You can type your questions in the chat and it will be collected by someone. But I also want to share, during this webinar, if by chance you feel troubled, you feel triggered, you feel bothered in any way by the subject matter being discussed, because we do understand that it is sensitive information, please, you can visit youngcaribbeanminds.com. Someone will type that in the chat. You can visit youngcaribbeanminds.com and you can click on the directory of services and you can click on your country and you will find a resource number for someone that you can reach out to, that you can call, so that you can have a conversation if you feel triggered during this time. With that being said, we are committed to decriminalizing suicide in 3 of the countries in the Caribbean. That includes Trinidad and Tobago, Grenada, and St. Lucia. And for the wider Caribbean, the movement is to ensure that there is access to resources. With that being said, join us on this journey, and thank you to everyone that has typed and honored that person in the chat that you thought of around suicide prevention. And we have over 100 persons online, and we thank you for that in such a short space of time, in 6 minutes, so we thank you. And we want to say, we are going to journey through our region, our one Caribbean region, and I am pleased to take you over to Guyana. Guyana, the land of oil as we know it today. Today we are going to have someone bringing us greetings, we're going to have greetings brought to us by Dr. Narayan Singh. He is the Chief Medical Officer at the Ministry of Health, and he will be delivering, of course, remarks, of course, on behalf of the Honorable Dr. Mark Anthony, Minister of Health in the Corporate Republic of Guyana. Let's welcome him at this time. Over to you.
Hi, good morning all. And it is indeed a pleasure to be part of this webinar on suicide. Suicide, it's a major problem in Guyana. And I just want to, of course, just apologize on behalf of Minister who's unable to be here this morning, but I hope I can fit in for him. On September the 10th, we all celebrated World Suicide Day under the narrative of changing the under the theme Changing the Narrative. Guyana, as you know, and those who have been following Guyana would have recalled or would have read in the news or that we were sometimes referred to as the suicide capital of the Caribbean. But that we did have high suicide rates. Back in 2020, we had suicide rates ranging between 90 to 20 per every 100,000 population, and it was very worrying. And so in 2022, we decided that we had to change the narrative. We cannot continue with this thing because it was a major health problem in Guyana. And we wanted to change this narrative to decrease the number of suicides that was happening in Guyana because it was going at an increased alarming rate. And so back in 2022, we decided to look at the policies, that was governing mental health, because mental health was one of the health problems that generally in most Caribbean countries was not much attention was being given to, but mental health now is now a major issue. We know that between 12 to 15% of Guyanese have a major mental health issue. That amounts to about 20 to 22% of our population having a mental health issue, and suicide was one of the ones that really stood out. And so back in 2022, we decided that we need to really tackle this problem and how we can tackle it. And we started from the top, looking at the policies and the legislation that was actually in place. Guyana had a legislation that was really archaic, dated back to the 1930s, known as the mental health ordinance, and it was really outdated. And if you at that time, in that mental health act that was there before, actually suicide was a criminal offense. You could have been charged and put in front of the court if you do survive and be charged for attempting suicide. And we know that one of the factors that was driving the suicide rates was because of it was not being reported, and because the fear of people reporting or even coming to seek services because of this fear of being criminalized or being put to the court. And so back in November 2022, we had to change a bill. New bill was passed, known as the Suicide Prevention Act, was passed in the National Assembly and it was ascended to. And that is a modern act that actually looked at suicide in a more holistic way, looking at decriminalizing the, suicide, and also looking at a more holistic approach and with a human rights-based approach towards suicide prevention and how we can deal with the matter. Since then, we have made several, as a result of the act, several policies have been put forward and have been implemented to help reduce the incidence of suicide in Guyana. One of the things that the act actually called for was for setting up of a National Suicide Commission, which is a broad-based commission with several stakeholders. And we all know that dealing with suicide is not only the responsibility of the health ministry, because it's multifactorial, and we need the inputs from all different sectors, the religious sectors, cultural factors, the cultural people, the education ministry. So we had this national commission made up of members from these representatives from these different agencies to deal with the issues of suicide. And from that, we were able to put together a national strategy, national suicide prevention strategy that was launched in July 2024, that details some of the activities that we will be doing over the next 5 years. to deal with suicide. And what we have been seeing is that there's actually a decrease in suicide in Guyana over the last 3 years. And I don't have a presentation you can see, but if you look at the stats here, you see the numbers of suicide deaths has actually been decreasing since 2022 with the implementation of these policies and um, programs that we have put in place. So I would want to share our experience. It's still a challenging work. We have introduced several programs, not only at the policy level but also at the levels of in the community levels. One of the things we have established is a suicide hotline, where persons with suicide in a suicide crisis can actually call into a toll-free hotline and be given counseling. We have had launched a platform, a suicide platform, where you can get information on suicide and can be referred, and where you can get access to services. We've also um, we've also activated what we call the Gatekeepers program, even at the community levels. The Gatekeepers program is a program where we involve community members, people in society, in the local community, such as the community health workers, the teachers, the faith-based leaders, and so on. They have been given training to recognize signs and symptoms of suicide, and when someone is showing suicidal behavior, they can actually bring that person into healthcare and to seek services. So far, we have trained over 725 persons throughout the length and breadth of Ghana as gatekeepers, and they are actually bringing those patients, those persons with suicidal behavior ideations, to seek services. Um, Also, we have extended mental health services to all 10 of our regions. One of the challenges we had was the lack of psychiatrists in the country. But we have actually, and there's never enough to spread around, but we have been able to institute mobile mental health clinics, going to these different hospitals and in the communities, conducting mental health clinics and suicidal prevention and talks. Another strategy that we have done is through the use of telemedicine, an innovative way of dealing with suicide. Persons can, in the absence of a specialist to deal or a counselor, they can they can make contact with a specialist via telemedicine, and this is some of the most remote sites, and they can have a real life conversation or counseling and even treatment recommended for those patients. So there's a lot of been going on in Guyana. We are seeing the impact of it. And this we wanted to share our experience with the rest of the Caribbean. We know that our national mental health plan is in alignment with the WHO mental action plan, and it is also in alignment with the Bridgeton Declaration that was done with use of that we pledged to decriminalize suicide. And I think this is a conversation that it's always there because suicide is ever present in our society. We haven't overcome the challenges yet, but we are working and we are seeing the effects of our efforts. So that's my opening remarks.
Thank you. Thank you so much. Of course, we must say thanks. I'm sure in the chat, I would like you to send a very positive emoji forward. We have to do young people things because we know that young people are greatly affected. So I would like to invite persons to just send an emoji. Select an emoji that represents your gratitude toward our Chief Medical Officer in the chat for sharing. This is amazing because I recall over 9 years ago, sitting in a room with regional persons, and Guyana was #1 for suicide. Wow. And to see that curve drop means that there are solutions that we can still apply. And I really want to commend, of course, Guyana for the great work that is being done. And we'd like to again thank the Chief Medical Officer, Dr. Narayan Singh, for bringing these greetings on behalf of the Honorable Frank Anthony, Minister of Health in Guyana. We thank you. And I hope that the emojis are coming. I hope they are hearts. I hope they are hugs. I hope they are claps. I hope they are positive things, because I think when it comes to discussions around suicide, support is critical and important. We thank you. With this being said, welcome to those who just joined us. And we're so grateful to have you. We have over 130 plus people here, and we're very grateful for your presence. We thank you. At this time, let's welcome Ms. Heather Stewart, Child Protection Specialist at UNICEF's Office for the Eastern Caribbean area. She will be bringing remarks on behalf of Mr. Abdul Kadir Musi, our representative, the head of UNICEF for the Eastern Caribbean area. Over to you, Ms. Stewart.
Thank you very much, Bertrand, and Dr. Narang Singh, Chief Medical Officer, who stood in for the Honorable Dr. Dr. Frank
Anthony.
Anthony, Minister of Health of the Cooperative Republic of Guyana, distinguished partners, guests, advocates, parents, young people, colleagues, and friends across the Caribbean. Good morning. Sincere apologies for the unavoidable absence of Mr. Musi, our head of office. But today we gather for an issue that cannot wait. It is really time to act. And suicide is not only a personal tragedy, it's a regional crisis that affects us all. We've heard the stats. It's the second leading cause of death among young people, aged 15 to 25, and 4 out of every 5 of those who die by suicide are under the age of 40. Now, these are our children, our relatives, our friends, our neighbors, and each loss is one too many. But decriminalizing suicide is not just legal reform, it is a lifeline. Such laws deepen stigma, silence those in crisis, and prevents them from seeking help. Removing these primitive laws opens the door to compassion, timely care, stronger prevention systems. Most importantly, it sends a clear message. In the Caribbean, mental health struggles should be met with support and not punishment. And Guyana, we take lessons from you. This is why UNICEF stands united with the countries which are charting pathways to ensure that suicide does not remain a crime. So, for example, in Grenada, we're supporting government's youth consultations and suicide awareness campaigns, both of which are informing national mental health policy development. In Trinidad and Tobago, we have just partnered with the Ministry of Health and the University of the West Indies to launch the You Matter Text Support Line. This service connects young people with psychosocial support provided by trained volunteers. And we're doing this while we're also supporting the support for necessary protocols. In St. Lucia, we're working with the government through the multiple indicator cluster survey to collect national mental health data that will guide future programs and policies. And these are all part of our broader commitment to help normalize conversations about mental health, to expand the safe spaces, and to support reforms that protect and support. So this morning, UNICEF's call to action is very simple. To government representatives and policymakers, please let's act with urgency to decriminalize suicide and strengthen systems of prevention and care. To educators and health workers, let's continue to build safe spaces in schools and workplaces where individuals feel heard. To parents and community leaders, let's replace silence with compassion, support, and advocacy. And to young people, keep leading the way and amplify your voices on social media and with your friends. Keep sharing mental health and suicide support resources that can be found on the website www.youngcaribbeanminds.com, and the link has been posted in the chat. Decriminalizing suicide is not the end of our work. It is the beginning of a stronger, more compassionate Caribbean. Together, let us build a region where anyone can say, I am struggling, and be met with dignity, help, and hope. UNICEF thanks all of you for being here today. Thank you.
Thank you so kindly. Special thanks to Miss Heather Stewart, Child Protection Specialist at UNICEF for the Eastern Caribbean area, of course, bringing remarks on behalf of the area representative for UNICEF for the Eastern Caribbean area. And of course, because today is a day of love and kindness and support, we cannot allow her to escape the love that we're sending out in honor of just supporting persons who may be experiencing challenges. Of course, I invite you to drop any questions in the chat or any comments. But at this time, you would have realized that the plane to off. It flew through Guyana. It landed in Barbados, where Miss Stewart is, and we can't leave her without a gift. So I just want you to type in the chat something very warm. If you were to, what would you say is your favorite thing from Barbados? Let's send some love to Barbados. I would love to see that. What's your favorite thing that you know about Barbados? Type something in the chat. Is it a singer? Is it a food? Is it a specific celebrity? What do you remember Barbados so that Miss Stewart can leave here with that positivity and hope so we can have a smile on our faces? I would love to look at the chat here. I see someone say Harrison Cave, the beach. No, we say the beach because we know that the beach is the place where you can go to take care of your mental health. The Caribbean is gifted with resources to just allow you to waft in the beauty of hope and care and love. And the beaches in Barbados are known for being amazing. Someone said Fish Friday, where you can get your protein source so that you can strengthen your brain's development and lower cortisol and increase endorphins on your way. So I see that there are some lovely, lovely things that are being put. Oh, this is great. Accra, someone said. Harrison Cave, someone said Rihanna. If you don't know who Rihanna is, you need to come up and learn more about that. And so we're seeing Cuckoo. I'm not sure if I'm Heather, you can shake your head if you know about Cuckoo. All right. But I see that, yes, she's like, yes, she is a Cuckoo expert. So if you need Cuckoo, you know who to go to. The only thing about mental health, as we know, is that sometimes we have to laugh at our calamity. Sometimes the stress of life, we have to smile it off. And we're even teaching coping mechanisms as we go along on this discussion today. So once again, thank you to Ms. Stewart. The plane is continuing from Guyana. It landed, of course, in Barbados. It has taken off once again. And we are now going to Trinidad and Tobago. And it's quite interesting because on this one, this young man who will be talking and representing from the youth perspective is a young man that I coincidentally met sitting on a plane. UNICEF held a training program to train young people from across the Caribbean to be youth advocates, a youth advocacy guide. And I just by chance ended up sitting next to this young man. And I looked over at him and I said, but he looks like a young man that is up for purpose and a mission. And I said, young man, where are you going? And he said, I'm going to a training. And I said, well, that's great. And ladies and gentlemen, I'm so pleased to introduce to you Daniel Lutchman. He is a UNICEF and Let's Unpack It Caribbean Youth Mental Health Focal Point. He will now be speaking at this time from the youth's perspective around mental health. We learned that that's the largest demographic that is impacted by suicide, death by suicide. We know that that age group is the second leading cause of death. So we must hear from that age group when we have this conversation as he shares about his experiences and what could be done. Daniel will keep his camera off for comfort so that he can share openly. And so we appreciate that. So now at this time, we'd like to invite Daniel to share his perspective from the youth voice. Thank you. Over to you, Daniel.
Morning. Mentally Butcher is a whole gas station to make you feel good. All right. So, growing up, I had a lot of challenges, right? Like everybody else. I wouldn't say that I had it the worst or anything, but to me, growing up, I felt that I had a lot of issues at home with my family and even at school. I wouldn't get into the real specifics because I'm not trying to like get triggered or anything, but I remember like holding a knife to like my stomach at maybe 8 or 9 years old, thinking that nobody would really care, and that I used to just feel like nobody cared about anything, and I didn't really have a purpose because I didn't grow up with like a lot of money either. I came from more like the poverty side, so to me, it's just like, it would be better if I just disappeared at that young age. And I really don't know what stopped me then. I just was like, I'm just not, and I kept on going, but the feeling was always there. And I remember starting high school and not being able to form proper friendships and stuff because I would always mistake, somebody kindness for their like giving me extra attention or something. I don't know if that makes sense, but to me, that's how it felt. And I didn't know how to really process it. So I ended up like starting really unhealthy coping mechanisms because I felt back then like I didn't know who to talk to or didn't have anybody to talk to, right? So at the age of like 11, because that's when I started Form 1, Form 1 to, yeah, Form 1. So I started like drinking really, really heavily, whatever I could I get my hands on actually. So my dad used to like, he had like a alcohol cabinet. I used to just go in the middle of the night and just take out some and put it in like a clear bottle so that people would think it's water. And then I would go to school with it actually. And then it's funny, but it's not funny. And then drink from it. And that was my way of coping. And, eventually I did that every single day for about a year or two straight. And I couldn't really feel anything after. So then I resulted into like self-harm. Uh, well, for those of you that don't know, if you drink a lot, your blood will get like kind of like diluted. I don't know if that makes sense, but if you're doing self-harm and you're drinking a lot, you tend to bleed more. So I remember a time I literally like was blackout drunk, and I'm talking about age like 12, 13, blackout drunk and like bleeding just on the ground. And I think my mom and them walked in, and she started to freak out. And to me, that was like a turning point, because it's like how it is your own mom gonna just view that whole situation, and she started like crying and stuff. But so I tried to like keep it within myself and not do any of those things. But in reality, I still felt the same way, and I didn't know how to really cope. Um, it's only later down in life I had a friend that she lost her sister to suicide, and uh, she told me her story. She said it was because her sister got sexually assaulted, um, and she didn't really feel comfortable in her own skin again, so she ended up taking her life. And well, the sister, my friend, she went through a lot, and she said that she didn't really feel comfortable being a woman anymore, so she was transitioning, and she had pronouns and etc. So the advice she gave me was to start with philosophy. That's what really helped her. So she gave me some books to read and stuff, and some online things to like videos to watch, and that's what I did. And to me, that really helped, because it gave a fresh perspective on the darker things in life and how to deal with them. Um, so my main reason for talking about this or even doing this is to like help people to realize that there are resources now that weren't available back then, even to me, because I didn't even know that it had anything free at all. I was like, okay, cool. I don't have no money. I can get help. That was my perspective, right? So the thing now is that I don't want anybody that was in my position to feel like that, because there are help and there are avenues or resources like Young Caribbean Minds that we can use, that should like highlights all the free resources in your specific country that could help. And what I would end on is that I think it's very, very necessary that we decriminalize suicide, so that a lot more persons could really see that there are avenues to help, and that it would be prioritized instead of just fragmented in some far distance when it's too late. So thanks for letting me share.
Thank you so much, Daniel. We truly appreciate it, and we appreciate your story. And I think everyone in the chat knows what to do. Please send some emoji of support to Daniel, because Daniel represents the demographic of young people that we have seen in the statistics in terms of how affected our young people are. And I want to see an overwhelming, overpouring outflow of an emoji that you think really represents just commending him for his strength, for his inspiration, for his sharing. You can offer a word of encouragement, because by offering a word of encouragement or an emoji to Daniel, someone else is reading this in this room today who may be challenged or struggling with their thoughts, or they may not know how to help a friend. And I will be so grateful if you can share and send these messages in the chat. I want to thank everyone. I see hugs, I see thank yous, I see hearts, I see people saying that they relate, you're not alone. And these are the messages that we want to amplify, so that all young people within the Caribbean can feel that we must advocate and address this. Know that you have heard the success stories in terms of how it has worked in Guyana. Know that you have heard from our, of course, Guyana representative. Know that you have heard from UNICEF in terms of strategies that we are working along with governments on to support these efforts. Know that you have heard from the voice of young people, the voice of young people who are most affected. It is time that we hear the strategies. We're moving along beautifully at a pace. It's time that you hear these strategies. There are 3 key resources that we are going to be revealing today. We are launching a new website. It's a suicide decriminalization effort with partners from around the Caribbean and the world who have joined in this effort. And these are the resources that are gifts to you that you can take away. There are 3 key resources. One is a guide on how to help a friend. A second, of course, is a guide on how governments can decriminalize suicide. And the third is a critical guide in terms of how can you be an advocate. You have sat here, you have listened, you remember your personal stories, you remember those who have been affected, and you saying to yourself right now, I want to join the movement. I want to be a part of this. These are 3 critical strategies that are going to be shared in this regard. To start us off, I'm going to introduce to you at this time the Suicide Decriminalization Legal Brief. This is for countries and for governments to use. It's not just about decriminalization, but it's about creating pathways. There's a brief that will be available for your download to access. Send it to your ministers, send it to your governments, have conversations with them. This is going to be shared by Mr. Leon Cherry. He's the co-chair of the Caribbean Regional Coalition for the Decriminalization of Suicide. And of course, I must say great congratulations to Leon for his recent scholarship or Commonwealth Scholarship to pursue studies linked to this field. So he has moved up to the Caribbean, but he's still putting time on a different time zone to support this effort. And we really want to thank you so much, Leon, as we hand over to you to start sharing on this very critical effort. Over to you, Leon.
Thank you, Bertrand. I just want to firstly introduce myself. So my name is Leon Cherry, and I'm a co-chair from the Caribbean Coalition to Decriminalize Suicide. And I also lead the efforts of the coalition in St. Lucia. And I'm joined today by my fellow co-chair, Desiree Nicholas, who is also leading the efforts of the coalition in Grenada. And what I want to do is to highlight the fact that the goal of the coalition is to frame suicide decriminalization as a public health issue and not one for the criminal justice system. And what we're hoping for with our policy brief is that we want to submit this brief as a guide to stakeholders, policymakers, and governments to support the work in decriminalizing suicide and to use it as a guide in suicide decriminalization. So moving on, in Grenada currently, this coalition is currently working with 3 key ministries in the Grenadian government. So the Ministry of Youth Development, Social Development, and also the Ministry of Health, alongside UNICEF. And the goal of the work in Grenada is to support and to advance the national suicide prevention strategies, but also to, like I said earlier, to give a guide in to support the work as well in Grenada in decriminalizing suicide. And also I can highlight the work in St. Lucia as well. So in St. Lucia in January of this year, we collaborated with the Ministry of Health and as the Ministry of Health's mental health support team to host a stakeholder consultation. And we had very positive reviews from that consultation. It was very clear that most of the members present was in support of suicide being decriminalized. And what we want to do is we want to show that our policy brief was actually a key resource in that consultation. And what it did was it provided, evidence in support of suicide being decriminalized. And also it provided, recent case studies in the Caribbean, like Guyana, as to why there are positive benefits to decriminalizing suicide. And finally, it acts as a guide, as a recommendation for the steps that we can take policy-wise in decriminalizing suicide. And so what I want to do is to show that, there's work being done in St. Lucia through consultations like this. But also, we also worked with, we also consulted PAHO as well. And what we learned is that the Ministry of Health currently convened PAHO to do a review of St. Lucia's mental health policy, because as it stands, we don't have a clear mental health policy. And so they tasked PAHO in helping them develop that policy. And what we did was we consulted with them, and we were hoping through these consultations that we can provide a guide and kind of like have a framework for decriminalizing suicide and to include it as part of the policy that will be developed. So moving on, in continuing to highlight the work of the coalition, we also launched a website as well. I don't know if we can go to the next slide. So yeah, so we as of today we'll be launching the website of the coalition, and on that website you can actually access our policy brief. And I want to give a special thanks to Maria O'Brien, founder of Mindwise, and her team, and their efforts to develop that website. It's something that we are very proud of because it can be a key instrument in helping us advocate for suicide to be decriminalized, but also it can be a kind of foundation for, or at least a key highlighter for the work that we've been doing. And so, what we want to encourage members who are present in this webinar is to access the website, access the policy brief, but also you can use the website to share the information there, including the policy brief, with fellow advocates and stakeholders and policymakers within your community. We need your support in spreading the word, and one of the ways that you can do that is by accessing the website and sharing it with members in your community. So what we want to do with the website and the work that we've been doing as well is to kind of highlight what is contained in the policy brief. And what it has is some of the key arguments for decriminalizing suicide. One of them is that, we have, a clear indicator that we need to repeal some of these colonial era laws, because suicide was actually decriminalized in the UK. It was done in 1961. So it's very clear that, our colonial masters, they moved on from some of these laws that, were implemented in their colonies. And so we should, continue by doing the same to decriminalize suicide. But more than that, it's very clear that also that criminalizing suicide also increases stigma, and it can also deter those from seeking help, because there's in most countries, there's penalties for attempting suicide. And so it acts as a deterrent, which is, very counterproductive to the intentions of these laws. But finally, decriminalization is also supported by the World Health Organization, which is aligned with some of the declarations in the Caribbean. And I think Dr. Singh alluded to the Bridgetown Declaration, which is something that was signed between different health ministers and stakeholders around the Caribbean, where they basically agreed to move to decriminalize suicide. And so we want to highlight the fact that the work that we've been doing and advocating for is consistent with some of these declarations from regional, but also international bodies like the World Health Organization. So moving forward, we can see that the work that we've been doing in the Caribbean also highlights where we stand legally in terms of criminalization of suicide. So, the slide gives a picture of where the penalties stand in these Caribbean countries. Now, some of them vary, but what is clear between the three of them is that there's still legal penalties for suicide being criminalized. And so what we want to do is to highlight the fact that this needs to change, but also to highlight the fact that also that there been momentum in all of these countries in moving forward to decriminalize suicide. And what we want to do as a coalition is to continue to support the work that has been doing in the Caribbean, and to also move us to the finish line where suicide can be decriminalized, in all of these islands. And so also, the legal brief also highlights evidence to the benefits of decriminalization. And so there have been very positive outcomes. And, Dr. Singh highlighted some of them in Guyana, which is something that is very commendable. And, we want to see some of these changes being effected in, the three islands that, I mentioned earlier. And so our brief clearly highlights some of these examples, not only in Guyana, but other international countries, like India and Kenya. And so what we want to do is to be part of that global shift to decriminalize suicide and to highlight the positive benefits of these changes. Now, the brief also gives recommendations and a call to action um, for suicide decriminalization. And the four main cases being made is that one, we need to repeal laws existing laws criminalizing suicide. So that's the first thing. Secondly, we need to also move to have and develop national suicide prevention policies, because this needs to be coupled with a move to criminalize suicide, to have a clear strategy in how we treat suicide, and something that can be, uniform across the island, so that somebody in maybe the south of St. Lucia doesn't have an experience with the suicide ideation that is different from somebody in the north of the island, and the same for the other islands. That there's a clear policy that all stakeholders are aware of, and that they can implement universally and in tandem with each other. But more than that, there's a need to empower youth voices in suicide prevention, and also some of the strategies, because like the statistic shows that it's the second leading cause of death in people between 15 and 30. And that means that we need to empower the voices of the people that are most affected, and to also learn from them some of the strategies that could be useful. I think it's very prudent that we listen to these young voices, because we can learn so much from them. And finally, it's clear that we need to align with international human rights standards. So standards set by the World Health Organization, but also by the International Association for Suicide Prevention. So this is the main and the gist of the policy brief, and then we hope that we can carry out this change in the region. And so finally, what I want to do is that I highlight the fact that we as a coalition, through this brief, we want to support, the national context and the work being done in these respective islands, and to also give a call to action for those other stakeholders in the island to join us and to help us in this movement. And we hope that we can also share success stories from your respective islands, so that we can collaborate together, because most of the stakeholder consultations that we did in the region was through a collaborative event. We shared a lot of information with each other, and so we want to hope that that trend can continue in the work that we've been doing. So thank you for joining. Please visit our website and share the policy brief, and just do and support us in any way that you can. Thank you.
Thank you so much, Leon. We truly appreciate it. Indeed, I see the appreciation coming through in the chat, and it's so critical for us to really understand the fabric around change. When we talk about this change, I know it's more than just helping a friend in a moment of need. We want to help the friend to access the resources and the systems. So we're looking at this as a macro approach. Our goal is to ensure that you are a powerful advocate in all aspects. And we really want to thank Leon. And I want to say this, you will see that there is a gender balance in this presentation. We just heard from Leon, and we also heard from Danielle. And why? Why? We know that when it comes to mental health, males are often the hidden aspect that we overlook. We know that men are less likely to seek mental health services and support than women. We know that depression signs may differ in men. They may lash out in anger when depressed versus females who may cry when they're sad. And this often masks the ability for them to get help. We know that men are 4 times more likely to die by suicide than women. And we also know that when men are going through a challenging time, they are 2 times more likely to develop alcoholism. And you would have heard from Daniel around the scourge of alcohol as a medication, self-medicating ourselves to cope with the challenges. And we laugh at it in the Caribbean. We have festivals, we have carnivals, we have amazing fetes that happen, and persons are medicating themselves in the midst of the revelry, not knowing that they are trying to run and escape. And so when we talk about this initiative, when we talk about the change that we want to see, we must look at it from the macro level. But if we come down from the macro level, we can meet somewhere halfway. You too can be an advocate. You can join this movement. You can create and be the change that you want to see, according to our great Mahatma Gandhi. And so we want to now have a conversation on how can you become an advocate. We are now going to transition to our second guide, which is going to bring us to our third and final guide. Will be coming up next, and then we'll be ending. So you are definitely on time. This guide is the Suicide Advocacy Guide. This is going to be about how can you join in this effort. To share on this, we have Ms. Asta. She is a senior officer on policy and advocacy from United for Global Mental Health. She's going to be sharing with us about how you can create that change by using your voice and using advocacy strategies from a global level, contextualizing it within the Caribbean context. She's been a pioneer with us. We really appreciate her efforts to bring these efforts forward, and I'm so pleased and thankful to hand over to Asta at this time.
Thank you so much, Bertrand. Hello, everyone. I'm so grateful to all of you that you've joined today, and it's really, really motivating to see that there are so many people who are interested in helping us in this journey, particularly because we know how important changing laws is for suicide prevention. And why is that so? I mean, most of it Leon covered in a very expertly, but I'll try and now say, how do we do the practical side of it? So what we did is, while we know advocacy is very powerful and we have a lot of resources to show that decriminalization is important, we have guidelines and standards, but we wanted to create a practical guide really listing down what these steps are that we can take. And even though we respect the fact that advocacy is dynamic, we have tried to at least create a sort of pathway that advocates can follow. So I have put the link in the chat for everyone to go and download this guide and use it in your day-to-day work, and I hope it is useful to you. Can we move on to the next slide where I can list down the major pathways to decriminalization? So what we thought this guide could do is list down the essential pillars of advocacy, but really look at what are these pillars. So the first pillar, and of course, you can refer to the guide because it's how-to guide. I feel like speaking about it is not as useful, but really reading it and implementing is useful. And you can come back to us with questions, and you can also give us your feedback on how you want to use these resources. So the first thing, though, we have described is how to organize civil society. So how to build a coalition, which could be of different types. The coalition that we have referenced the most is the Caribbean Coalition for Suicide Decriminalization that we started last year. And of course, all these wonderful partners that you see on the slide, Lifeline International, IASP, CariCope, Mindwise, Let's Unpack It, and UNICEF and UGMH have come together to create a coalition where we can really motivate everybody to work together and organize ourselves. Because, one voice is lost in the in all the din of the world, but when we all come together, it becomes a powerful collective, and everyone knows that really there is power in the people, there's power in the movement, and there is power in our voice. So if we come together, we can really move mountains. So we have tried to really list down how we can do this together. The second is, how do we choose a pathway to legal reform? And this is important because when we actually start talking about decriminalization, we all know it is important. We all know how to find what is the law that is discriminalizing suicide. But the pathway to legal reform is important for us to understand as to, is it judicial? Should we file a petition in the court? Should we approach a parliamentarian? If you know a parliamentarian in your networks, can you approach them, explain the work to them? Or can you tag on to another policy? For example, in India, the Mental Health Act decriminalized suicide, and a national suicide prevention strategy followed later. So we have a lot of options, but it is important for us as a collective to decide what option works best in which country. So our wonderful advocates from the 4 countries in the Caribbean coalition have worked to find out what is the best pathway for them, and we are still working on it in some of our countries, but in Grenada and St. Lucia, we have made a lot of great progress, which you can see up on the website. The third thing is how to use inclusive language. So, when we come to suicide decriminalization and talking about suicide prevention, there are so many things which might be triggering, which might not be correct. So, it's very important for us to use the right language and also use the language which we are able to explain to different stakeholders what is the importance of suicide decriminalization. So if you speak to the media, if you speak to health workers, if you speak to normal lay people who actually don't work on mental health on a day-to-day basis or have no idea actually about mental health and don't engage with it as a lot of us do, how do you explain to them what this means? How do you use inclusive language? So that's again an essential pillar which we have included in our how to guide. And the last thing, which I think is so important, is how to align with relevant stakeholders such as the media, religious leaders, people with lived experience, and parliamentarians. And we have quoted real life examples from different countries where decriminalization has already happened or is in the process of happening, on how media can be engaged better. And we have also tried to narrow down as to if you don't know anyone in the media, how do you build those connections, how do you reach out to people? And it's not important for you to know everything beforehand, but how can you really cultivate these relationships? And if you don't know parliamentarians, there is still a way for you to reach out to them. There are letters that you can write. There are so many things that you can do. You can reach out to other civil society organizations working with parliamentarians, figure out a way to work together. And with religious leaders, how do you really make them understand that this is about compassion? Suicide decriminalization is completely aligned with all religions. It's not against any religious beliefs. It's actually for religion because it's promoting compassion. And then we have people with lived experience who are brave, who are sharing their stories, and who are willing to put their stories out in the world so that people can hear them and then change their mind. So, strong people like Daniel, who have brave people like Daniel who've shared their stories with us. We need those people to come out, talk about their experiences respectfully, and of course, we should be able to then change people's minds with that. So with that, I don't want to take too much of your time. I would really urge you guys to read the guide. And the last snapshot that I wanted all of you guys to see is this one aspect that I've pulled out from the guide is about how have we created really snapshots for you to just use in your day-to-day conversations. So for example, decriminalization encourages suicide attempts. That is a misconception, because people actually, when they fear legal penalties, that increases suicidal behavior because they're not seeking help, they're not able to ask people for help, they're not able to uh, express their distress, and that increases stigma, and it doesn't remove the barriers to care. Actually, it actually stops people from getting timely intervention. So decriminalization doesn't encourage suicide attempts, it just helps people to get to a hospital in time, or get to some professional help in time, or even talk to their families or trusted elders in time. The second misconception is suicide is a crime, so punishment is justified. Well, suicide is a complex health issue. It is not a crime. It is not a sign of a moral weakness. It's actually not even related to mental illness in all cases. It's sometimes simply a response to distress, which is a public health issue. And we need to make sure that that is clear to all stakeholders that we work with, that we need to respect dignity and we need to give people a compassionate approach to suicide prevention. And that can only happen if we decriminalize suicide. And the last misconception is that the law isn't enforced much. So why are we changing it? And that's a very fair question. People ask us that no one is enforcing it in my country. So why are we doing it? Well, even if prosecutions are rare, the existence of the law itself creates fear and stigma. And you will notice that in countries where this law exists, there is no suicide prevention strategy, there is no suicide prevention plan, there is no proper data collection of suicide attempts or suicide deaths, because of which the health legislation is not up to the mark. You're not able to help people who require help. And this is a punishment based model which exists, and it reinforces negative attitudes even among health providers and police because they don't know how to react. And a very powerful thing that was shared by Mr. Leon Cherry in one of our earlier consultations was, even if someone's not prosecuted, they can still be taken to the police station. They can be detained for a while. They might feel humiliated. They won't know how to access help. No one tells them that they need to access help. No one guides them because they don't know how to guide them. So, if we have proper suicide prevention protocols in place, we will be able to train the police and the executive to guide people, to take them to the right services, direct them in the right way, and respond with compassion. How do you respond with compassion? Because these are your own people. So I feel it's very, very important for us to make sure we know these misconceptions and the answers to them. And I'm 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 sure most of you will find this in the guide and will be able to use it on your in your day-to-day advocacy. And for those who want to join us in the movement, please visit the website, please join the CSDC, and we will really, really appreciate your help. So thank you so much.
Thank you so kindly, Asta. We truly appreciate your sharing. Asta has been just a force to be reckoned with in this space. And as you can see here, she answered some of the key questions that you may hear from time to time when we talk about suicide. It's on the books. It's not important in terms of decriminalization. These are key things that we must look at multiple levels when we look at making change from an ecological standpoint. And so we really want to thank you for that contribution. You will be happy to know if you're having a light break at this point or having breakfast. We have one more presentation and we're coming to the end and we'll be opening up for questions. Please feel free to type your questions in the chat so it will be identified. But we're at the point where we spoke about it at a macro level, then we spoke about it at a midway level where you can get involved, and now at a personal level, on the micro level, your family member. We spoke at the beginning about someone that you may have known who would have died by suicide. We can look at it in terms of someone you heard of, someone who reached out to you that probably you didn't even know that they were going through this. How can we help someone with us? And we want to keep the very positive tone in here today. We want to keep a very light tone. And I want to reinforce, if you are joining us now and this conversation is making you feel a bit uncomfortable and you want to speak to someone or you need guidance, we would like you to visit. We have links in the chat, youngcaribbeanminds.com. Click on directories and you can reach out to a service provider in your country. You can call them, you can contact them. And then, of course, we have the Suicide Decriminalization website, which is csdcoalition.org. And there are also links there that can lead you toward the support that you may need. But before we continue, as you can tell, the plane landed in, of course, we went to St. Lucia, Santa Lucie, if you speak French, and then the plane took off again and it landed all the way in India. So this train is moving. This is a global movement and it will not be in vain because I know that we have advocates in here who are committed to make the change. So if you ever wanted to be an advocate, you have the guide in front of you. And because Asta is joining us all the way from India, and that's a completely different time zone. So it's a different time zone in the nighttime. We want to say thanks. And if you could offer one food, one favorite item from your country, what would that be? Please type that in the chat. Now, I know people are going to type a lot of interesting things and just see where you're from. If you're from, of course, if you're from Trinidad and doubles is a thing, type Trinidad doubles so she can see where she can visit the next time she's advocating. Of course, if you are from Jamaica and you want to type something there, like, you can say jerk chicken, you can type that as well. Someone said bacon shack, Maracas, Trinidad. So there you have it, Asta. You have a lovely guide. And why are we doing this? Because sometimes you need to take a mental health break. Sometimes we feel overwhelmed by the pressures of life, and that leads us to the place where we want to give up. But here you have in the chat some recommendations of things that you can do in your country. I'm already seeing in Grenada, oil dung. That's healthy food. If you eat oil dung, I heard, you'll be buff and strong for days. You can lift and climb the highest mountain, I have heard. So you have recommendations here of things that you can do to take your mind off of. And food is one of the things, the strengths in the Caribbean cuisine culture that helps us to make it through. With that being said, yes, please type in the chat things that you recommend to Asta. And we want to thank her for taking time off on a different time zone as well. Thank you, everyone. And we see the countries that have been impacted here. And I really want to pause and say thank you once again to everyone for joining. We have come to our last presentation before we go into the grand big finale, which is the call to action, where we are going to challenge you to one very small action that you can take that can move mountains. And so this time I would like to introduce Miss Desiree Nichols. She'll be talking about the very critical area of how can you help someone in crisis, a practical guide toward support, prevention, and healing. I have been working with her for a while. This is the person we message at any time to say we need to do this, and it's a positive movement because we believe that change will come, and through the Caribbean advocacy. And I really want to thank her for always being very amiable and workable at all times. And I really want to hand over to her at this time to talk about that personal touch. What can you do on a personal level while we wait for the macro change that we indeed need to see? Over to Desiree at this time.
Thank you so much, Bertrand. So happy to be here, and I really, really appreciate all the presentations that were made thus far. I'm Desiree. I'm a licensed clinical social worker. I'm from Grenada, and I'm the founder of CariCope as well as co-chair of the CSDC. And today I will be presenting on ways to support yourself as well as loved ones, because we know that suicide is something that respects no culture, race. It can affect anyone. And so it's important that we feel equipped to deal with it. I wanted to highlight, as we're talking about caregivers or supporters for people who are struggling, some of the common feelings that can come up. Shame, asking ourselves, how did I not know what's going on? Guilt, did I not listen enough? Did I not watch them enough, right? Anger, asking yourself, well, how could they do this? Avoidance, well, if we pretend this didn't happen, it will go away. Sometimes people feel fear as well. Well, will they try this again? We often even minimize the situation. Oh, they're just asking for attention. And sometimes we may even feel like cutting people off. This is not my problem. Someone else can deal with it. These are some of the common feelings that can come up. And I wanted to highlight this shows that we need more resources. And so this is what we're offering today. How can you support someone, right? Think about showing empathy, and the things that we say to someone can really show that we care. And so these are some things that we can say. I'm so sorry you've been feeling so bad. I'm so glad that you're still here and you're still alive. I'm here for you. Remember that you can always talk to me if you need to. I want to help you. Tell me what I can do to support you. I want to urge us to also think about asking open-ended questions instead of starting with why. Why did you do this, or why didn't you tell me, often causes people to be defensive. So think about using open-ended questions that start with who, what, when, where, and how. Who can we talk to the next time you're feeling this way? What can I do to help? When did that happen? Where can we go when you're feeling this way? How can I help? I wanted to also highlight some helpful and unhelpful things when you're supporting someone who is struggling. You want to listen and try to understand the person's feelings before offering solutions. Don't simplify things or use a quick fix approach. We may often feel urgency when someone brings up the fact that they're feeling suicidal, right? And so we may think about using quick fixes, but try to slow yourself down and ground yourself and really listen to what's going on. Remove possible means to suicide, including drugs, alcohol, and weapons if you can. Don't punish a person by saying things like, I'm not talking to them until they straighten themselves out. Be sure to get family or loved ones involved to assist you in supporting the person, because you may not be able to provide support 24/7, all right? Don't abandon the person by saying things like, I can't take this, I have to leave. Consider assisting the person with writing a safety plan. So that is something where they can list out the things that tend to cause them to be upset, what they can do to cope, and also who they can reach out to for support, whether that be people in their social circle, or professionals that they can reach out to, like counselors. Avoid making the person feel guilty or selfish by saying things like, how did you think this would make me feel? We want to remember, when someone is opening up to us, we don't want to make it about us, right? And for people who are in crisis, here are some things that we want you to think about. Knowing your triggers. It's so important. If you can learn to identify your triggers, you can become more self-aware, which gives you a lot more control because you can anticipate things a lot easier. So identify the events and feelings that usually lead to suicidal thoughts for you, and use healthy coping skills like going for a walk, making art, listening to music, right? There are a lot of things that we can do, a lot of things that often we felt connected to in childhood are often associated with healthy coping. So what did you do as a child that always felt good, whether it was going, playing cricket, drawing, or just scribbling? Those things may seem simple, but they really, really help. Distraction is something that really, really helps. Healthy distraction as well, right? Talk to someone you trust. The urge to isolate can be very strong when a person is feeling suicidal or when you're feeling low. So the key is to allow others to be there for you. I'm going to say that again. Allow others to be there for you. This can help you remember that you're not alone, right? Remove immediate risk. So this can be alcohol, other substances, weapons, anything that could be used to cause harm to yourself or can end up triggering suicidal thoughts. And of course, seek mental health support, like local hotlines, therapists, psychiatrists. It is really time that we understand that mental health support can benefit any and everyone, and that asking for help is a sign of strength. And so we've created a guide that you can actually access on the CSD Coalition website. So you can go to csdcoalition.org/resources to access this guide. It highlights everything that I've shared today, as well as the policy brief that was shared earlier as well as the advocacy guide that Asta would have just shared. So thank you so much for giving me the time. And I really hope that you find the guide on the website, and please share it with as many people as you can, because the more our community feels equipped, the more we can take care of each other and prevent suicide. Thank you so much, everyone.
Thank you kindly, Desiree. We are coming to the end. There is one major movement that we all must take. When this challenge is issued, we simply ask that you send it out all over WhatsApp, all over social media, everywhere that you can. At this time, I'd like you to do another special final action in the chat. I would like you to think of one word. If someone in here is impacted, they're thinking about, look, suicide is probably an option. If there's someone in here that just needs to hear one word of hope, what would you say? We have over 150 persons here right now. I would like to see over 100 persons type at this time. If there was one word of encouragement or a sentence, I see you are loved, that is powerful. There's one thing that you can type in the chat, one love message that you can put here, and you could even send this to someone. What would that be? You matter. That is powerful as well. And people need to know that. Thank you for sharing that. That's powerful. Someone said you are not alone. You have purpose. Take it day at a time. I see you. You belong here. And I want us to remember these moments, even for ourselves, because we know that persons who are engaged in the fight for others sometimes have low days when they see slow movement. I want all of us to read these very powerful affirmations and forms and sources of encouragement that are listed. Thank you all so much. This is powerful. This is powerful reading them. It's giving me goosebumps just looking at it. And I want, if you feel like you could take a picture of one aspect and you want to share it with a friend, just who you know is going through a hard time, feel free to do so, because we are coming to the end. We are coming to the end of this webinar. And know that you've learned about the macro level, the mid level, the micro level, about the actions, the way that you can help someone in need from Desiree in a very tangible way. The do's and the don'ts. The last aspect that we would look at now is about how can you take action? How can you take action? We want to specially invite you to the website. You should be seeing this on the screen at this time. If you aren't seeing it, you can, of course, message. But this is the final movement, the Suicide Solidarity and Support Call to Action. Today, we launch a Caribbean Suicide Decriminalization Coalition call to action. No one should be left behind. We want to encourage you to join in this effort by putting your name toward advocacy for two critical areas, decriminalization, and also to advocate for persons to have access to resources and pathways toward help. We would like you to join in this effort in a simple manner. When you go to this link, you see it here, and someone please type this link in the chat, bit.ly/unite in support. Please type this in the chat, bit.ly/unite in support. I want you to type that in the chat, and I want you to type this on your phone, and I want you to prepare this on your own. That's the first step, to send to a friend. And when you visit that link, bit.ly/unite in support, I want you to click on that link, and that link is going to take you to this page, Solidarity and Support, a call to action. And this call to action is very clear. It says, signatures in solidarity and support, call to action. A call to action for suicide decriminalization, the creation of support mechanism. In the past year, Caribbean countries have reported troubling increases in child, youth, and male deaths by suicide, and women as well. Everyone, we've seen the newspaper headlines. Your voice can help to amplify urgent support to those in need. We need your voice. We need your support to develop suicide-related support mechanisms across the Caribbean, of course, and to decriminalize suicide in Trinidad and Tobago, St. Lucia, and Grenada. As a coalition, all of the members, as you've seen the logos on the screen, are amplifying to say suicide is the second leading cause of death among 15 to 25-year-olds. 80% of persons who die by suicide are under the age of 40. And finally, 79% of persons who die by suicide are males. I just want to thank you all because I'm already seeing things popping up saying that people are signing on to the website and taking that move. And I want to thank you. It is blowing up on our end. And we want to have at least 2,000 persons per country that are affected by suicide decrim, and hundreds and thousands of people from across the Caribbean, and you can be from outside the country as well, signing on to this. So we want to have everyone, regardless of where you are, doing this call. The simple action is to add your name to the call to action to help advocate for a Caribbean where supportive mechanisms replace laws that limit support for those in need. You are simply going to put in your country, your first name, your last name, your profession, your organization, and an email address, and you will click submit. All that does is allows for your name, for your voice to be a part of advocacy efforts saying, we need more resources for young people, for adults, for men, women, aged persons in our region. Things are getting difficult in the Caribbean. We are most at risk as SIDS, small island developing states, for natural disasters. That affects us in great ways when people lose things, lose everything over and over every year, struggling to keep up. And so they need support too, because sometimes they feel as though enough is enough and they can't go on. And for this reason, I encourage you to sign up. You saw the link there. It's quite straightforward, bit.ly/unite in support. We want you to click join the call to action. You can visit the website and you can simply enter your name in support of this so that we can have thousands, over 10,000 people from around the region advocating for this. This is your final call, your final act in terms of putting the discussion to action, because you now understand how these mechanisms need to be put in place. With that being said, please, I believe that it is in the chat. I am going to now close this link because I think everyone has the link, all right? And we are going to end with any questions that may have been placed in the chat for just a brief open discussion at this time. So at this time, if there are any questions, we have persons on standby who are monitoring the chat and they're sending questions my way. If you have a question that you'd like to direct to one of the presenters, this was set for an hour and a half, so we have just about 15 more minutes before it ends. I want to thank everyone. We're seeing the messages, the emails coming in, and so your advocacy is a powerful tool. It's a powerful tool for someone who needs that support and help. Your name on something like this can encourage someone to keep going, and we thank you all so much. I want to simply ask, please type a question in the chat. If you have a question that you'd like to direct towards someone specifically, one of the speakers, you can do so, or you can just ask a general question and you can offer thank yous. If that's the case, I see Nandita would have shared, thank you for organizing this much needed discussion, because yes, you're correct. It's a serious issue and it's a pleasure having you all. We were overwhelmed by how many people registered. We had over 500 people register for this webinar. That shows that people genuinely care. So we had to pause on too much marketing, because we know if we passed 1,000, we wouldn't have enough space in the chat, as has happened in the attendance, as happened before. So I want to thank you all for this, but you can still share the link, all right? You can share the link with someone and you can do this. And so I'm not sure if there are any questions. I am monitoring the chat to see if there are any questions. So I believe that please send the team will be sending me questions that I can read out. And so I will also try to answer any questions that I see as well and redirect them as possible. I will be checking now to see what questions are being sent that I can respond to. And please feel free to direct your questions to anyone specifically. All right. So I would like to start with the open conversation. Someone said, can the slides be shared? Yes, fortunately, all of the slides have been put together in a bite-sized manner. I'll ask for Desiree or Leon or Asta to just type the link with resources. It's resources, very short website link where you will find all of the resources that we discussed today in one page. So you can go to that link on CSD, our coalition website, and you can, of course, download it. So that is there. So I am continuing. I love the words of affirmation. Someone said, one step at a time. Someone said, how can we help from Italy? We're happy to have Europe supporting us in this effort. Happy to help in any way. I believe that you can share the link where people can sign in solidarity. You can share that throughout your networks in the Caribbean. Advocate to anyone, that governments, people who can listen, organizations. That's a start that you can definitely do. So that is there. Someone says, I'm new and confused. Thank you. And this is what we want to do. We want to educate people on the ground, because sometimes when you don't know your rights, you can lose them. Sometimes when you don't know your right, you don't know that you can advocate. And so this person is saying, I'm new and confused. How is suicide a crime? Who gets charged when one is overwhelmed? A very good question. So that's the thing. It's on the books. It's on the books that if someone, you saw it from the 3 countries that were mentioned, what the penalties would be. And so it's something that we would have inherited from many, many, many years ago, to be quite honest, on our books. And so countries are moving toward removing them. And so that's the tricky part about it, but we're working to change that. So in terms of the charging, people may be held, it creates stigma. So we want to remove that. And so good question. It's very confusing, but that's why we need to really advocate for it. I'm now looking at some of the questions that are being sent to me that I can respond to. Someone says, yes, I do not mean to discredit anyone's efforts, but I would like to know why it takes years to accomplish something small, like decriminalizing suicide, especially after UK decriminalized it in 1961. Honestly, I feel as soon as possible, if not immediately. I want to thank you for your advocacy, and I see people liking that comment. And that's the thing. Sometimes things take longer, but what we do know is the more voices come together, we can make a change. Never give up on your voice being able to contribute toward making a change. And so for you, thank you to, I think it's Sonia that sent that comment. What you can do is advocate. You can share the signing, the signatures, you can share the resources, and that we can amplify. So thank you so much. Really appreciate it. And really, really appreciate what you would have said. I think it seems as though persons would have really benefited from it. I'm seeing some of the positive comments that are going toward the presenters. So thank you to all of our presenters here today. You had a holistic view of the challenge. And of course, we have no intention of keeping people longer than necessary, because I know that people have bacon and roti and other things that they would like to eat. But our effort is to ensure that this is here. Our next step is that we're going to compile this live video into a recorded video. It'll be uploaded online. And so you can share this as an advocacy tool to persons that you think can help with the change as well. And so this is something that we definitely would want to do. I think the fact that based on the comments that I'm seeing here, it is quite clear indeed. All right. Someone said they're hosting an education segment on television, Preserving Lives. And well, you can ask any of the speakers to attend. You can amplify that voice, and please share that website on the television program that you'll be on so that people can get resources and also advocate for for change. So we truly appreciate it. So we'd like to say the only thing that we can ask of you is that you share the resources, share the call. Could someone type in the chat one more time that critical website that can be shared on WhatsApp, on social media, in your social media stories on Instagram, Facebook, so that people can sign on? Is bit.ly, and that's the link there. And that's the one last action that we ask of you so that people can feel supported, cared for, and the positive affirmations that you would have shared. At this time, it's now 11:20. And so we are coming to the end of the webinar. We'd like to thank all of you all as we finish on time. And could someone please type the bit.ly link in the chat once more in terms of the call to action? And someone will put that in the chat so that people can see it. I see someone asking for it. Excellent. Thank you, Asta. And there's also a bit.ly link that's easy to remember. So we can also share that so people could see bit.ly and as well. So you can take this away, you can take a photo, and we want to thank each of you for all that you have done. With this being said, we are coming to an end in this. There it is, bit.ly/unite in support. Unity in support, so it's unite in support. That's the website, bit.ly/unite in support. With that being said, I'd like to end. Please take a photo of the link on the far right-hand side so that you can go away with it. With that being said, we're coming to an end of the webinar. I'd like to thank all of the presenters. A special thank you to those who brought remarks. Special thank you to the Chief Medical Officer, our UNICEF representative, all of the presenters, Daniel, the Youth Views, those of you who offered affirmations within the chat. Together we can. Let's end it off by sharing with as many people as you know, bit.ly/unite in support to make the great and significant needed change that we need to see in our region. We thank you and we wish you a very pleasant day ahead. Thank you all, and to all a good night, as they say.
Thank you, Bertrand.
Thank you, everyone.
Thank you, everybody. Great day.
All right, take care, everyone.
Take care, everybody.